right, so let's begin. Can everyone hear me? Great, thank you so much. Well, good morning, everyone, and welcome to Social Media Week at PCI. Thank you for joining us today for what we hope will be a dynamic discussion with a panel of leading healthcare communicators. I'm Jonathan Briggs. I'm the Vice President here at PCI, which stands for Public Communications Incorporated. Today's topic, activating your audience through social media for the healthcare industry. Our panelists will answer your questions, discuss best practices, and really share their experiences in using social media to reach key audiences, while also being sensitive to compliance and regulatory guidelines. Before I introduce the panelists, I want to mention a few housekeeping details. We encourage you to share your real aha moments, your real-time aha moments on Twitter and Facebook using the hashtag SMWHealth, which you see up on the screen. We've also included the all-important Wi-Fi network and password for this floor. And bathrooms are located at the end of the hallway for both men and women. Our discussion is scheduled to end at noon, but please stick around. We have a little surprise for you at the end, so don't skip out too soon. So now on to our panelists. I'll introduce them in the order in which they'll be speaking today. Nicole Mladic is a communications director at Northwestern University Feinberg School of Medicine, where she is responsible for strategic planning and development of marketing, communications, and public relations activities. She previously was vice president at MSL Group, the firm's Chicago office, where she served as a senior manager on consumer health, corporate and education accounts, and was a core member of MSL's North American digital practice and new business teams. McCann is the media relations manager for Northwestern Memorial Healthcare. She oversees the daily operations of the media relations team and drives social media strategy for the healthcare system, including original content development that highlights Northwestern Medicine's nationally recognized clinical programs and experts. Her primary areas of interest include neurosciences, orthopedics, sports medicine, clinical research, and using PR to support community service and volunteer global health efforts of Northwestern's physicians. Next, we have Natalie Cammarata. She's a public relations associate for the American Society of Anesthesiologists, where she manages social media efforts in addition to serving as a media relations specialist. She is a PR professional with agency, association, and healthcare experience. Natalie is also a freelance writer and has been published in Chicago Tribune, Red Eye Chicago, and Chicago Now. She graduated from Ohio University's E.W. Scripps School of Journalism with a master's degree in journalism. And finally, last but not least, we have Jeff Capaldi. He's Director of Digital New Media Strategy for the American Medical Association. Jeff has spent his career thus far telling stories, primarily from a newspaperman's perspective, but most recently wearing a marketer's hat. At the AMA, Jeff is capturing the attention of some of the same physician audience he reached as a longtime art director and social media strategist for the American Medical News. As the AMA transforms its digital presence, his team is leading the effort to refine the execution and strategy for its mobile app and social media and web channels. We've asked each panelist to speak for 5 to 7 minutes on a specific topic, and after each of them has spoken, we'll open it up to Q&A. So we'll start with Nicole. She's going to discuss how the Feinberg School of Medicine uses analytics to determine content and social media engagement for physician audiences. Please welcome Nicole.
Thank you. It's a pleasure to be here today. I'm excited to have these panelists here to learn all about what you guys are doing. I'm representing the Northwestern University Feinberg School of Medicine, and we are a top 20 research-intensive medical school. We have missions of research, education, and patient care. In social, we cover education and research, mostly because we have 9 major affiliates who provide patient care. And so they handle a lot of the patient care communications for us, which is great because it means we don't have to necessarily constrain ourselves with the HIPAA requirements if we're just focusing on our research and education. We are probably the smallest in social media of the group here, but I think we probably have the biggest array of topics that we talk about, the biggest group of professionals. We have 4,000 faculty that are part of the Northwestern University Feinberg School of Medicine. We have 26 different departments, and we have more than that in terms of our research centers and institutes. So it's quite a large group of people, and they range from very engaged in social media to not engaged in social media at all. We started our social presence about 5 years ago. We currently have Facebook, Twitter, LinkedIn, Instagram, Flickr, and YouTube profiles. We find that these channels are each reaching different audiences, and we have varying degrees of success with our basic channels. We are doing, I would say we're doing very well for our peer group if you look at the top 20 medical schools. In terms of audience size, we may not be the biggest in terms of followers, but we do a lot better in terms of engagement than some of those with really large numbers. So I think we're going to talk a little bit today about how we do that and how we get to those insights. I will tell you that 5 years ago, our students and faculty were not sure about social media. We survey our incoming students annually, and the first year that we started doing social, people were very reluctant. Our students, our physicians, our researchers, they were very reluctant to connect their personal profiles with our academic and institutional profiles. And I'm pleased to say that this year, our incoming students, 90% of the incoming class was already following us on Facebook when they got here. And they'll continue to follow us. Our Twitter number is a little smaller, but it is definitely growing as well. So we're finding that our students, faculty, and staff are sort of finding their home on social media in terms of being able to follow us, share, and really engage with us on different channels. As I mentioned, our audiences are very different per channel, and I'll talk a little bit about who those audiences are. So I'm going to be sharing with you a little bit about using analytics to define the content of the channels that you're working with. We use very basic, low-cost measurement tools. They're mostly in-page analytics. So in-channel analytics, we are constantly looking at our Facebook insights, our LinkedIn insights. We're using Twitter ads. The insights that you have there, we don't pay to have ads on Twitter, but they do have free analytics as well. We use Flickr Stats. We use Hootsuite. We have a sort of basic monthly subscription to Hootsuite, and it helps us schedule our posts and learn a little bit about our followers. And we also use Meltwater, Meltwater Buzz, which is a social media app, and we have a partnership with that with Megan's team at the hospital. And so those are the basic channels that we're using. We also apply those with Google Analytics. I have the ability to look at Google Analytics at any time. And Google Analytics recently opened up a, well, not recently, they've had it for quite a while, but they have a social media portion of the page that is geared towards analytics specifically. And when you log into your Google Analytics, it's free, and you can actually go in there and see which social channel is performing the best to send visitors to your website. You can also track, there's a social flow function. So for instance, we know that we have a lot of prospects on Facebook, not only because Facebook gives us the demographics, but I can go into Google Analytics and then track what those Facebook links are doing. And so I can tell you that the majority of the biggest part of the page that people are going to after they click on our news story is our admissions site. So you can actually track who's coming in, what part of the site they're then going to, and that can give you a little more insight about what your followers are doing. So again, I had mentioned that we use these basic channels that are free. I would say that they're probably the most ignored part of actually producing social media. We counsel a lot of our departments, institutes, and centers. And I also work with other folks in healthcare marketing. And looking at your own metrics, your free metrics, is probably the one part that people just kind of ignore. They think they can tell which content is doing great just based on the sheer amount of likes. And that's not necessarily always the way that we choose to do it. So we produce a bi-weekly report to share with our team, and it tells us which posts have done the best that week, which social channels are performing better than others. And it helps us actually when we do the end-of-year analytics to be able to tell what types of content, photos, videos, links, just individual text posts, which types of content are doing best in the mix, what stories are doing the best. My writers use that to kind of develop what they're doing, and I'm going to go fast over the rest of these. So we do produce that. I already talked about using Google Analytics as part of your reporting. Using the cheap tools to keep an eye on buzz. If you know you have a big press release coming out, we're constantly searching and sending all of that to our faculty members who are really pleased to hear whenever they have had a big story. And then in terms of metrics, it's sort of how you want to measure it. So we're currently looking at, sometimes our Facebook posts are outperforming some of our other actual newsletters. So, we recently had student milestones always do the best. And we had a Facebook photo album that for us got 12,000 clicks among our very small audience. That's pretty great compared to a lot of our other, pieces of marketing that we're putting out. So I would say just looking at all those is very important. Understanding how they can fit with your mix and measuring them up against what your other vehicles are doing is really important when you're looking to figure out your types of audience.
Thank you, Nicole. Next week, we'll have Megan, who will discuss finding the right approach for engaging with healthcare professionals and consumers. Thank you, Megan.
And I'm actually going to stick mainly to patients, just because I think some other people here can actually talk a little bit better about healthcare professionals. And certainly, I think everybody who's on social media knows you have a lot of different audiences. But for us, a lot of the healthcare professionals that are our audience are also our employees, which means they are patients, because that's where their insurance is. So they're kind of the same approach to all of them. But a little bit background about myself. So I've been with Northwestern Memorial for about 4 years now. Prior to that, I was with Advocate Healthcare. I worked with Advocate right when they were starting to launch social media. I was actually on the first task force there of pilot users, and our first dive-in was everybody was on Twitter for the first time. So it's kind of amazing to me that just this short years later, this is what I'm doing almost at least 50%, if not more, of my time every day is dealing with social media. So a little bit about Northwestern Memorial. Northwestern Memorial Healthcare is the parent company of Northwestern Memorial Hospital, which is ranked number 10 in the country by U.S. News and World Report. Again, number 1 in Chicago and Illinois as well. We also have Lake Forest Hospital, which is in Lake Forest, Illinois, and then we have a pretty large outpatient reach in the northern suburbs. And you may have seen in the news lately, our family's getting bigger as we've just merged with Cadence Healthcare, so it's a very exciting time for our organization. Our external brand is now Northwestern Medicine, so actually in the last year, all of our social media has been rebranded and transitioning from, it was Northwestern Memorial Hospital before, and we had a very singular focus of that patient population. Now we've stepped back and we're taking a broader approach, both geographically and we're looking at outpatient, we're looking at our smaller community hospitals. We also, Northwestern Medicine includes Feinberg School of Medicine, so we also think about that audience as much as we can. And we really try to think about the vision of Northwestern Medicine and everything we do in social media. And so that vision is exceptional patient care, advance medical science and knowledge, and develop people, cultures, and resources. So our strategy is really built all around that, and then as well as the mission of Northwestern Memorial Healthcare, which is patients first. Everything we do is about the patient, and that is the hallmark of every aspect of our organization, and for social media, it's no different. It's really kind of useful that we think about it when we go into social media, because we really think about how can we serve our patients on there. And the main way that we do that is that we're trying to be a useful tool where they can go and get really informative and empowering healthcare information. So information that makes them think, I need to go get that screening, or I need to make an appointment about that, or I need to talk to my family about that. We also really celebrate our patient superstars. So if we have a patient who they're a remarkable person, even if it's not something we did for them. We find ways to share their story. A lot of the great ways we do that is by asking our patients to tell their own story in their own words, and get on our blog and tell their story, and we can celebrate them that way. But then we also see it as a tool that we can extend the patient experience beyond the walls of the hospital. And I think in any industry, healthcare, airlines, restaurants, hotels, there's a transition from customer service going to a desk or calling a number or sending a letter to I'm going to go to Facebook, I'm going to go to Twitter. That's where I'm going to get my answers right away. And in the last just year alone, I can say our number of patient concerns, patient questions, patient complaints that have come directly through Facebook or Twitter versus coming through the normal channels has completely flip-flopped. We see it all the time. And when people come to Facebook, it's not we want a response tomorrow or next week. They want a response then. So for me and my team, who we're PR professionals, we're all of a sudden wearing a very different hat than we used to. Now I'm also customer service. I have to figure out where am I going to send this person? How am I going to help them? And 97% of the time, I'm not the person who can help them. So one of the most important aspects of what we do is knowing who those people are within the hospital, within all of our hospitals, within our outpatient system, where we can really get answers quick and have a really strong protocol for responding to those. But everything we do just goes back to that main mission of patients first. So really the ways that we use social media, beyond, as I said, patient experience and customer service, it's really a reputation and awareness key. That's always been our primary focus. We have a pretty decent following on social media. We were actually just named the number 10 social media friendly hospital in the country by Nurse Journal this morning. So cheers to my team this year. Not that we're gloating or anything. But we see it as a tool for reputation and awareness. And the key to that is really using great storytelling, which I think is the key to any good public relations. And my team is a fantastic team of writers that we couldn't have the success we have on social media without them. One of the things that has evolved very quickly over the last couple of years is that we used to repurpose content, press releases telling the same story, but now we're really creating original content that is only for social media. And that's been a really great tool in telling those stories that wouldn't have been told otherwise. It's an embarrassment of riches, the number of great, amazing stories that we have within our institution. We have some of the leading physicians and the leading researchers in the country, and they're doing amazing things that I can barely believe every day. But there's also the really cool stories of the husband and wife pair that are, a neonatologist and a gynecologist. So one of them's delivering babies, the other one's taking care of the baby when it's sick. That's a great story, but there's not always time or a place to tell that in the media. Now we're able to share those stories and put them out on our blog, put them out on Facebook, and really be able to celebrate everybody's success, but just in a different way. And I'm going to stop at that because I'm running out of time, and so hopefully I can answer things and questions.
Thank you so much, Megan. That was really great. Next, we'll have Natalie, who will discuss how to plan strategic social media for specialty medical associations.
Good morning. As Jonathan said, my name is Natalie. I'm the PR associate for the American Society of Anesthesiologists. Thanks to PCI for having us all here. This is really fun and exciting. I'm going to talk a little bit about strategic planning for a medical specialty association. So ASA serves about 52,000 physician anesthesiologists. When I came on board almost a year ago, they had a strong social media following, but content was lacking. There was a lot of marketing push and a lot of educational product sales type of posts. And very little two-way conversations, interaction with our followers, engagement was low. So I was tasked with putting together sort of an external strategy where we look at our content and our followers and ask the question, how do we get people to really engage? What do people want to see, and what will people want to interact with us about? And then the second part of that was putting together an internal strategy. Basically, we wanted to see what was the best way to develop content internally, so that it would be cohesive. All our posts would be, aligned with the same voice, but the information was coming from different departments within the association. So the biggest challenge that we faced was there was an ongoing campaign that basically had us set up with 2 different accounts on each platform, and one account was for the public and one account for our members. And it wasn't resonating very well. The following was lower on the public account. I think people just didn't really get it. So we decided at that point to combine those accounts and just make it for all of our audiences. But that still is a challenge that we face as far as developing content and choosing what we want to put out there, because our members are physicians, and then we also have this public group of people who's following us and looking to us for information about patient safety and awareness and things like that. So that was probably the biggest challenge. What we ended up coming up with were 2 tools, 2 sort of solutions to help implement these strategies. And the first was a social media matrix, which sounds fancy, but it's just a document. It's just a 1-page document that outlined all of our platforms, what they meant to us, what they were going to do for us going forward. We eliminated some platforms and really decided to streamline and hone in on the ones that were important to us and the ones that were currently successful and that we saw potential with. And then it also outlined our audiences who we were going to serve with those platforms, the metrics we were going to use, and really what we wanted to see going forward with each of those. And then the second tool was a social media task force, which helped with our internal strategy. Each department within our organization appointed a representative to the task force. So, everybody from the marketing department, PR, meetings, education, and so forth, each had a say in what social media was going to look like going forward for ASA. So since our implementation about 10 months ago, all of our main outlets have increased followers by about 40%. Engagement is up, numbers are great. There's always room for improvement, and we are looking for ways to improve every day. But we've seen it just turn into something really, really great. And so along the way, we've developed some best practices, which I'm going to fly through because I have about a minute left. So I would say determine a schedule and stick to it every day. Everyone's is going to be different. I wake up, go to work, 8 a.m., schedule all of my posts for the day, and we use Hootsuite. But then I pick certain times during the day to monitor and look for retweets and favorites, things like that, things I need to reply to. The second, establish a content development process and stick to it. So, for instance, our task force members send us content that they want to be posted. I go through and edit, make sure everything kind of aligns. Just make sure you're sticking to that process so that it is the same over time. And then the third is proceeding with caution. This is kind of an interesting one because, in a lot of situations now, people are always, doing things and then asking for forgiveness. In the social media healthcare world, be careful with that. I mean, there are so many regulatory and legal ramifications that you really need to be aware, pay attention. If you don't know, ask someone. Go to your legal counsel, go to the director, whoever it needs to be. I think that's really important. And then lastly, just always be evolving. Use those metrics. You might have had a really successful conference and social media engagement interaction was way up. You can always improve. Use those numbers to find the posts that work and keep posting that way. Just always be working on what you're doing and improving social media in that way. That's it. Looking forward to all your questions.
Great. Thank you so much, Natalie. And last but not least, we have Jeff Capaldi, who will discuss how to reconfigure your social digital outreach and achieve the right mix of content and platforms. It's a mouthful, but...
Happy to be here. Thanks for having me. One of the things I found most interesting so far is that everything that they're talking about is exactly what we've been doing. It's really, there's not going to be a lot new under the sun that you hear from people when you get down to what the basics are. The situation that Natalie described is very similar to what I went through with the AMA. I started a year ago, had come from another aspect of the AMA, which was a publication called American Medical News, and had grown their social media audience from zero And that's a tough thing to do, to grow from no one. It's all about awareness, and all of a sudden, American Medical News was closed, and the position became available in the marketing arm there. And so I inherited 300,000 Twitter followers and 50,000 Facebook fans who were just fed a steady diet of press releases. And you're just like, why are you here? What do you want from the AMA? You know, name alone. So, but it was one direction. It was pushing toward them what the AMA wanted to say, and so it was a highly unengaged audience. And so you have to sort of strip it back and start looking at the things that will inform your understanding of what exactly you should do next. And it's not just simply putting a question at the end of the post and hope that they'll respond, because a lot of them are probably ignoring you. And so some of the questions that we asked first were, well, what are the metrics? What, you know, to give a nod down there to Nicole, basically, what do we know about the audience that has assembled? Because we were on all the channels. We were basically having a presence, posting with a little bit of regularity, but no one knew how big was. No one knew what a big post meant. No one knew what the exposure was over a period of time to be able to say, this is the audience that's still sticking around. And so you have to kind of start establishing baselines that are what motivates you to sort of grow against that. And then we'd say, well, what's the difference between the people who are at Facebook and the people who are at Twitter as far as what they expect of us? Again, you know, no one knew. And it wasn't because the people who worked there weren't capable of understanding it. It was just there was no ownership, which I think is another aspect that you walk into when you have a situation where social media is not doing as well as it could. They hadn't committed to there being a department. There hadn't been sort of an opportunity for someone to say, I own this, and here's how we're going to move forward. And the other piece that they didn't have is they didn't have really, past those press releases, much opportunity to sort of get people to the stories, you know, which is what Megan was talking about. That's another key piece that you're going to find everywhere. You have to humanize it. You know, you have to be able to create an opportunity for someone to engage with it on the level that they're expecting on social, which isn't a flood of data necessarily. It isn't, you know, sort of scaring them into something. It's sharing the warmth of a story. Those will always outperform the scary sort of items, and so they didn't have an avenue for that. So last fall, a big reorganization happened in the marketing arm that basically said we're going to have investment in social media, which was what the department I'm in was created. They said we're also going to have a blog, a publishing platform that isn't through the voice of one person, but it's almost like our news outlet where we tell these stories. And it still covers the ground that you might expect of a marketing department. It still is sort of addressing the key strategy areas that the AMA has, but they're smart enough to know that you can't just repeat the same thing over and over again, and that becomes our backbone for the content we can send people to. The blog is a publishing platform where we can get those human stories with greater depth than you would just within the social post on its own. And so the media team is getting the exposure there, and we're sharing our victories on social. Our own blogging team is writing the material that's the basis for the story, the narrative that we want to create. And the social team is figuring out how to engage an audience that, you know, had gathered before, probably completely ignored us when I took over, but we sort of said, all right, now we need to at least talk to them, because inherently AMA stuff's not very viral, you know, so we needed to talk to them first. And what we started to see was enormous growth in Facebook, because the AMA had launched some initiatives that were built around public health, things that involved pre-diabetes, pre-hypertension, sort of making physicians aware of the importance of programs that they might not otherwise be mindful of, you know, diabetes prevention programs and things of that sort. And so patients are interested in that, doctors are interested in that. That's not heavy advocacy stuff that intrudes on sort of the environment that people are accustomed to in Facebook between the puppies and the grandkids and stuff like that. You can't really have heavy advocacy stuff. And so it started to resonate, and that audience started to grow. And we went from 50,000 likes in September of last year to more than 200,000 most recently. And a lot of engagement there in a way that is about sharing, not just the consumption behaviors of clicking a video, going to a website. We still get that in large numbers, but for the most part, we came to understand that, you know, Facebook for us, 75% of the time, the action was likely just going to be that they would share it in some form to spread it out to a broader audience. And so that sort of became the beginning of seeing, all right, well, Facebook is not the same as LinkedIn, is not the same as Twitter. And so we started to break down the data to see where we can have the most success on the different channels. The problem with that can be when you have success broadly, everybody else gets crafty and decides, well, maybe they can help me too. And you're sort of like, well, we know that that's not really what might be well received by this audience. And so you kind of become, I don't want to say a victim of your own success, but you do have to sort of reinforce that the understanding of the audience is built on numbers. It's not just gut and instinct. And that's where, you know, the analytics come into play. We live by our analytics, we love them. So it's the kind of thing that hopefully there'll be more questions about that because it's essential.
Great, thank you so much, Jeff. We did have a couple of questions that came in on social media, but I do want to open it up to the people who are here with us right now. If you have any questions for our panelists based on some of the things they've shared thus far. So I'll turn it over to the audience. Anybody have a question or two or three? Yes, in the back.
So with privacy being a big concern, when you're looking for stories, how do you balance that privacy of the patient's story? If it's a patient,
Sure. So we really don't approach social media any different than we approach any media story we tell or any patient story that we're going to write up for a website, an internal story. We have a patient consent form that all of our patients sign. I think for us where it becomes a challenge is that our social media that's controlled by my department is very successful, very well-oiled machine. We're at the point now where it's kind of bursting at the seams. Everybody's ready to dive into social media, and we either have to put our arms around everything and not do it well, or let the reins loose and start guiding our different clinics in different areas on how they can do their own social media presence with guidance and backup from my team. And that's, for me, that's the kind of things that keep me up at night, is how we are going to avoid those HIPAA complaints and those breaches of privacy. So it's really just having a strong counseling voice to those people, making sure they understand you can't just go out there. Even you and, you know, Mrs. Smith, who came in today, is really happy because her hip replacement went well and she wants to take a selfie with you. You can't put her selfie on the Facebook page or on the Instagram. That's going to get us in trouble. So it's really just reiterating that, getting education out there to really a new generation of caregivers too, because Nicole and I have discussed this quite a bit, and I think you guys have probably seen it too. There's an older generation of physicians, nurses, staff who want nothing to do with social media. They don't get what it is. If anything, their kids tell them something about it. But like the next generation, this is what they've grown up on. This is what they do. So it's completely natural to them to take a picture in the hospital, do all these things. It wouldn't ever strike them as being not okay. So that's where we really have to pay attention. And so what we're doing now is we have a social media policy, which I'm assuming anybody who's doing social media should, and if you don't, you really need to get on top of it and write it and work with your legal team, because it offers you a lot of protections and guidance. But we have every new employee now who comes into the Northwestern Memorial Healthcare System, part of their orientation process is that they have to do an attestation at the end of their orientation saying, I read the social media policy, I understand the social media policy, and I'm going to abide by the social media policy. And a large part of that policy talks about patient privacy. So that's how we protect ourselves.
And we, as I said, we work with a lot of hospitals who take care of the majority of the patient news for us, and then we are just responsible for sharing. But there are two instances in which this might come up. The first is when students are working with patients. We have not had an incident, and our students are you know, they get an orientation on all of this, so they know not to put any patient data, even if it's de-identified patient data, you cannot put that on social media. I have seen students at other schools, though, putting up de-identified patient information. You know, they'll put a chart or they'll put an EKG reading, And we keep a very tight ship on our monitoring, so if that stuff comes up, we'll be able to contact the student immediately. And we work, Megan made a good point about 97% of the stuff that comes in is not Megan's department's responsibility, but I think for us in social, it's incredibly important to be able to raise the concerns of the flagpole when needed. And so part of your social media policy should be knowing which departments and who has responsibility for making those changes. So if a student does something in social media that's sort of against our social media policy, I know exactly who I need to go to get that taken care of. The other situation where we come across patients would be clinical trials. We do thousands of clinical trials, and we have to get, anytime we're talking about any kind of clinical trial in social media, we have to get it approved by our IRB, and that would happen at the point of writing the story instead of by the time anything gets to social media, all of those hurdles have been cleared for the most part. I don't know, Jennifer Barker, who's with our cancer center, is here today, and she may have a little different experience because basically all your patients are in clinical trials.
But I tread very
You tread very
cautiously,
lightly, yeah.
partly because it's been hard to pin down exactly what you can and cannot do. So if in doubt, I
Yeah.
don't.
Yeah, so Jennifer just said if she's in doubt, she doesn't post it. So that's sort of a good rule of thumb in healthcare to live by.
I just want to follow up really quickly on something that Nicole said about surveillance and monitoring, because that really is key. There's been several situations within Northwestern where it hasn't been one of our employees that's been violating HIPAA, but it's been an outside vendor who's working in the hospital, whether it's a plumber or a maintenance guy, somebody who's come in for something. We treat a lot of VIP patients, which can present a whole host of challenges with the media. I have had situations where a VIP patient his wife was delivering at Prentice, and I only knew that because there was a outside vendor tweeting to all of the sports media in Chicago, telling them that this person was doing that. We had to track that person down and shut it down immediately, and then it started a whole conversation about how we get our vendors on board and make sure that they're signing things that cover social media, not just, any other privacy issues. So those things do happen, and if you're not looking for them, you're missing them. And even if you are looking for them, it's hard to find all of them because big plays with a lot of different people in there.
We got another question, first in the back and then in the front.
I'm just curious, for those of you that work with associations, how do you decide which outlet you're going to disseminate information in, whether it be Facebook or an e-blast to your members or Twitter? How do you kind of make that differentiation, I guess?
That's a good question. I think, it was interesting when I first came on board because we had such well-established followings, and then to go through and really decide what each platform was going to be used for was kind of crucial, and that's something that you need to look within your own organization and see what is resonating well. I would say a lot of times it is it's hit or miss. Like, you check the metrics, you see what posts are working. If something is working better on Facebook and Twitter, you can take a look and see how that post was constructed, what information was included, if there was a picture or a link. Obviously photos are huge and resonate really well with all audiences. But as far as other forms of communication, we, e-blasts, things like that, we use a lot of, basically anything that's going in an e-blast is also probably going to be on social media as well. So, any post that's going on social media, we look through and say, is this really crucial information enough to expand upon, to email all our members about? And a lot of it's not. So we kind of have to think about that. And then the other issue with that is some of our e-blasts that go out need to be private. So some of our advocacy type of issues that we're emailing about can't go on social media. So, whether or not it's public information or not comes into play for sure. Thanks.
From the AMA standpoint, I would just say that one of our biggest challenges has been really being mindful of some of the channels that people are getting things from us. And vast organization, a lot of business units have email lists, and a lot of them are accustomed to sending an email whenever they want. And so what we've discovered is that many physicians are kind of, they're getting way more than they need. They're tuning us out. And so, you know, the big piece that has been in play for the last year is starting to refine some of the tactics that we have to make there be fewer options. Options that you can measure more clearly and that you can start to say, this is what this one's good for. This is, you know, the audience that we know to be there, you know, so rather than there being a lot of different ones and the business unit feels like they've done their bit, they've sort of, we sent it out to our audience and you get very little response from them. You have more potent channels. Sort of one quick example of something recently was last week the AMA announced some EHR principles that they believe are things that need to be in place for physicians to have a more satisfactory system. And they had 8 things that this panel put together, and a lot of media coverage went very well as far as that piece. And then the request was made, get physician engagement on this. You know, the panel put together the list, and we're getting exposure for it among the influencers and things like that. But we want physicians to feel like they can talk about it. They can tell us what they think are the most potent of the things within this. And so we got to a point where we were saying, well, where's the way that you do that? You have to know who's where. And the measure for us on that little enterprise was going to be response. It was going to be who gave us something thoughtful. And so the idea was, well, let's do a poll. Well, you have to sort of square it up for them so they have the answers, and then where do you house the poll? And so we were bouncing back and forth on a lot of things, and what we resolved was on the blog platform we would write, which has commenting at the bottom, we would write something that basically announced again these principles that were at play and said it's important that we hear from you as well. AMA has some email vehicles that people subscribe to that include news and some AMA sort of matters that go out, and so we have a members-only Saturday one. We're like, that has a good open rate. That's going to get in front of the right audience. And if we can direct them to the blog and they can comment, then we're in business. That will be quality feedback. And so everything worked as planned. We got, you know, a lot of quality feedback, but not as many comments as we might have had on Facebook, but not the right audience on Facebook, largely a patient-based type of thing. And so when you can narrow it down to just a handful of platforms that you understand deeply, then your options become a lot simpler.
Thank you. I was wondering if anyone could speak to using LinkedIn for provider recruitment.
Did everyone hear that question? Okay.
We're on LinkedIn. Probably it's been less than a year since we really gotten less than really happy with my teams here because they're gonna make me look smart. But no, our HR team signed a partnership with LinkedIn less than a year ago. My team's involvement in it has really been driving the content on that page and developing that and making sure we're keeping it fresh. But the recruitment is really working out of our HR department, so I can't really speak to how successful that's been, but I will say the engagement on our page has grown quite substantially since they started using it more as a recruitment tool. And I just pulled the numbers, and I think we're seeing something like, it's a very big split from employees versus non-employees, which to me is symbolic of the fact that there are people who are coming there who have an interest in our organization, where very well maybe because they want to work there, and that number has grown quite a bit since we've been more active on there and they've been doing more outreach on there. But I can't, beyond just using it as a content sharing platform, I don't have too much insight on it.
Well, do you just, so your strategy then for LinkedIn, in that case, you're just repurposing things that are being used elsewhere in social media, or are you selecting B2B kind of content, or?
Yeah, we select things that are very, awards and accolades, things that really showcase our organization and its strengths, things that highlight our employees and our physicians on a personal level. So I'm not going to put a post on there about high blood pressure. I'm going to put, we have a doctor who was the medical director for the U.S. World Cup team, and there was a really nice feature story about him in the Sun-Times. We posted that because it's celebrating personnel, it's showing we care about our employees, we want to celebrate them. We're opening a new building in a couple of weeks, and we did a lot of promotion of our facilities, and these are the places you should be working if you worked here. So if you're an orthopedic surgeon, you can be a part of this great new center. Stuff that makes it look like a place you want to work at. And we do share some health tips, but they're or health information, but they're things that are going to apply to a professional audience. So we did some media around disconnecting from your iPhone, which I'm sure everybody in this room should probably read that. But you know, like that's important to a professional audience because we're all checking email at home on the weekend at 10 p.m. You wake up in the morning, it's the first thing you do. So that makes sense for LinkedIn. And we just, NU just released a study about why it's healthier to have windows in your office. Really, actually, sad research, if you don't have windows, don't read it. But like, we got so many comments that were like, there's no windows in the pharmacy, or there's none of this. Like, it definitely resonates with people. So we look at, we're not going to put everything on LinkedIn. We're going to put things on LinkedIn that make sense for people we want to recruit or people who are professionals. But at the same time, we might use those things on Facebook too. We're just going to tell it differently.
And I'm sorry, just to be clear, it's your department that's doing the content. It's not HR, right?
Yeah, we drive all the content. HR is using it for recruitment.
And Northwestern University doesn't necessarily, they prefer to do all of their recruitment in-house. So we also have a LinkedIn profile, but it's primarily for alumni engagement. And our alumni, we do have quite a few people who are not faculty or staff who are following us. So we use it a little bit for awareness, but we share the same types of stories. In particular, new hire stories are really good. Sort of ranking stories are good. And occasionally we get requests from individual departments who may have bigger positions out there that they might be looking for a very specific kind of a person. And so if that's the case, we do sometimes put an announcement about a specific position, but the university's HR department does not work with LinkedIn, so it's a different strategy.
I can speak a little bit to this because we work directly with our HR department on our LinkedIn company page. We have a separate LinkedIn private group for our members. We're not doing provider recruitment on the company page, but just association recruitment for positions that open up. And actually, the task force representative in the HR department was huge in really kind of when I came on board saying we really need a LinkedIn company page to improve and showcase, like make it just showcase what we're doing. And it's really nice now that we can add photos because they resonate really well. We've seen a lot of engagement with that. We just moved to a beautiful new building in Schaumburg, so people are really excited about it, and obviously that is a benefit that new employees would enjoy. So same kind of thing. I mean, I work with our HR manager to come up with content, and she kind of sends over all the new positions, what might be interesting to new hires. And then we also do newsy type of stuff, so awards, press releases that would be interesting to the public, so they know what kind of work we're doing and what kind of organization we are.
Question here? Yeah.
For the association side, we have seen things where some of the patients would actually share their stories through our Facebook page, and that turned into like a piece of content we want to use. And we initially made the assumption that by sharing it fairly and publicly, that ClearCut saying, use this. What are your thoughts on that?
Yeah, absolutely. We've done this. We had a couple of comments on our Facebook page, saying that they had an amazing story about a physician anesthesiologist who saved their life or their daughter's life in one situation. And we reached out to them and got an amazing story that's going on our website in a few weeks. And they were more than willing to share all the details. Obviously, we had them sign a consent form. We also spoke with her physician and had him sign the consent form. And it was nice to get both sides of the story. And I think absolutely. I think if you reach out to that person and they're no longer interested in sharing too much detail, or they don't want their story to go on a website somewhere, then the road ends there. But I think it's a great tool for finding stories and finding people who are who want to work with you.
Right, where the question came in, someone shared their story that they wrote through their blog, and they shared it on a page. So we were kind of internally saying, by them sharing it through like a public kind of forum, would they be consenting already?
I see. That's something I would go to legal about.
Is there an online question?
Yes, we have a question from Twitter. For those who respond to patients, how do you determine what you respond to? When must you take the conversation offline?
So our goal is always to take the conversation offline. It is because it's more just for the privacy of the person, but transparency is really a big part of how we respond to social media. So we have a comment policy that outlines what you can say on our page, what you can't say on our page, when we can remove it, when we don't remove it. I would say 99.5% of posts stay on our page, no matter what they are. That's just our policy. That's always been our policy. But we respond to all of them, so most of them, I would say. There are some where it's not necessarily needing a response. It's more of just commentary, venting, airing things out. But we just have a really, really great relationship with our patient representatives department. Those people are honestly, they keep me employed, because there could be a lot of problems if it wasn't for them. And I think if you're doing social media for a hospital, those are the most important partners you can have. They know how to deal with people. I'm a communicator, so I can communicate well with people, but I'm not a customer service person. So the first thing you should always do is establish that relationship, make sure you have a protocol in place. Not everything's going to fit into your standard process, but most of what you're going to need to do is going to fit into that process. So for us, as soon as we notice it, whoever on my team notices it kind of activates an email chain that goes to the patient rep saying, hey, this is the comment, here's what we're saying, expect a phone call. And then we have a number that they can automatically call. So the message is always, we just say, hey, but thank you for your feedback. I'm casual today, I'm sorry guys. Thank you for your feedback. We're sorry you had a negative experience, but we want the opportunity to right the wrong or discuss it further. Please call our patient representatives department or send us a message with your information, and we'll have them call you. My patient reps are so awesome that most of the time, before I've even sent that message, they have figured out who the person is in their system and called them and taken care of it. And I can't tell you how many times we've had people come back and remove those comments, or come back and say, thank you, this has been taken care of, you fixed it, I really appreciate it. So while we still have a negative comment on there, we also have the process of it being fixed, and normally it's within a couple of hours, so that's better PR than deleting it and hiding it, because it shows we're there. Now, it means people come to our Facebook page more, and it makes my team much crazier because of it, but it's beneficial. It works out well in the end.
Great. So we have about 5 more minutes, but I do want to ask you guys one more question. There's a lot of conversation about Facebook and Twitter, a little bit about LinkedIn, which is a little different because LinkedIn walls off its content, so it's harder to make it be connected. How do you evaluate what channels you're going to invest in? Instagram has been exploding in popularity. Have any of you considered Instagram? Okay.
I think Instagram's a really great tool for a hospital because, especially an academic medical center, if you ever go to a community hospital and the personality is there when you walk in the door, it's a very family-oriented place. People who are coming in from the suburbs, they're coming in from different places, and they're coming down to a big academic medical institution. They're thinking they're going to have 12 doctors in their rooms at all times. There's going to be no personality. It's going to be cold. And Instagram gives us the opportunity to show a kind of behind-the-scenes look of these are the people that make this place special, and so we can celebrate that. And it also gives us the opportunity to, if my team's covering a story and they're in an OR, we're doing a story on awake brain surgery, that patient's consented. We can snap a picture and we can put that on Instagram. And where else are you going to have the opportunity to see somebody talking in an OR while there's a surgeon in their head, on Grey's Anatomy? But Instagram gives us the tool to do that every day. So it makes it kind of a more approachable place. And so I really like Instagram for that purpose, and we are starting to see quite a bit of growth there. So I think it's been very successful for us.
I'm going to go back to your question. We always start with demographics when we're considering where we invest time. There were 2 suggestions that we had, and my boss, he goes to these marketing conferences and people kind of suggest, you guys should be on this, you should be on that, and we always, whenever there's a question, we go back, we look at the demographics. For instance, Google Plus, there seemed to be a lot of pressure for a while where folks wanted us all to be on Google Plus. I never saw the demographics that I needed with Google Plus, and actually I went to Google and asked them for the demographics, and they wouldn't give them to us. From what we could see, they were doing really well in Europe and the UK, but in America, they never really had the demographics, and furthermore, they never really had the engagement from what we could see from who would be our prospective followers. We did an inventory of what all of our peers were doing, and we found that not very many of them from the academic side were on Google Plus, but a lot of them were on Google Plus on the clinical side. So, for us, it's demographics and kind of what our peers are doing as well. Another example is Pinterest. Pinterest actually has a lot of interesting demographics to us in terms of women of certain sort of recruitment age that would be either students, alumni, or prospects for us. But the habits and the sort of the psychographics on Pinterest aren't there for us. So there is not a lot of talk about healthcare and wellness that we can see. If we had a dietetics program, or if we had nutrition, or if we were putting out recipes, or I have a lot of friends who or companies that are consumer facing, those are great for Pinterest and for that demographic and for those habits, but it's not there for us. So we look very closely at all the demographics before we decide to invest time.
One of the things that I would add to that is it's important to know who's there, but it's also important to know what you can add to it and how exactly the resources you'll be given to sort of sustain that. Instagram is a great platform, but if you don't have visuals, you don't have the access and the possibilities that Megan described, then you're a bit player, and that becomes ultimately something that people point to as a failing of your social endeavor. You don't want that. You want success after success, and you want to, rather than sort of have things that you've marked off a checklist of 8 places you are, you want the 5 places you are where you're rocking it, basically. So that's always a significant consideration, because a lot of people are wanting to see what exactly will you be delivering with this, and perhaps more importantly, how much money is it going to cost me to break through there. And so as a result, the AMA is pretty limited in some of their efforts on places like Pinterest and the visual-driven ones, because it's a little tougher for us to have the replenishing content that we know is what's important there. We do well in the other channels, but we're still trying to figure out how do we realign our resources so that perhaps Instagram or Pinterest can be something that makes sense for us.
Yeah, and I would add to that about Instagram. Actually, my colleague Amber is here, who we just recently dipped our toe into Instagram, and Amber did a really great inventory and audit of our peers who were on Instagram, and then she came up with a content plan before we ever got into Instagram. We knew what we were posting, what the major milestones were, what the content will be, and how we would get it, so that when we got to Instagram, we weren't just instantly, for the first 2 weeks filling it up with content, and then after that going, oh my gosh, what are we going to put on here? So.
Absolutely. Well, thank you so much. On that note, I want to bring our panel discussion to a close and thank our experts for sharing their expertise and insights. They will be available for a little bit after the panel to answer your questions. But now for the surprise that I mentioned at the start. Anyone who uses the hashtag SMWHealth will be entered into a drawing to win a Fitbit activity tracker. We will choose the name at random at 5 p.m. today. So continue the conversation in the ether through that hashtag. And I think it's really great for you to share your aha moments and your takeaways for your colleagues that weren't here. We really appreciate you joining us today. I do also have one small request. For anyone who's interested, will you join me in a group selfie that we can post to our page? I'm going to pull an Ellen DeGeneres here. If you stay seated just for a second, I'm going to try to get us all in. And feel free to share and tag yourself. Oh, you guys are beautiful. I love it, love it, love it. All right. 1, 2, and 3. All right. Thank you so much, everyone. Appreciate your attendance.